Today, we're diving into one of the most exciting and transformative developments in the world of medicine: the combination of artificial intelligence, AI, and gene editing. This powerful duo is paving the way for the future of personalized medicine, an approach that tailors treatment specifically to the individual, rather than taking a one-size-fits-all approach. These technologies are not just advancing medical research, they're revolutionizing the way we understand disease, health, and how we can treat individuals in the most effective way possible. Let's take a closer look at this new frontier in medicine and explore how AI and gene editing are coming together to create a new era in personalized healthcare. The rise of artificial intelligence in medicine. Artificial intelligence, or AI, is already making waves across various industries, and healthcare is no exception. At its core, AI's ability to process vast amounts of data, identify patterns, and make predictions is transforming how we approach patient care. In personalized medicine, AI helps us move away from the one-size-fits-all approach to healthcare, allowing doctors to tailor treatments based on a patient's unique genetic makeup, lifestyle, and medical history. AI algorithms are being used to analyze data from a patient's genetic profile, medical records, and even lifestyle factors like diet and exercise. This leads to a more precise understanding of how a person's body will respond to specific treatments, medications, and interventions. AI-powered platforms can predict the likelihood of certain diseases, identify biomarkers for early detection, and even recommend the best course of treatment for individual patients. This level of personalization allows for earlier interventions and better outcomes. Understanding gene editing and its medical potential. Now, let's talk about gene editing, particularly CRISPR-Cas9, the technology that has captured the world's attention. Gene editing allows us to alter the DNA of living organisms, including humans, with unparalleled precision. In the realm of medicine, this technology holds the potential to correct genetic mutations that cause inherited diseases. Imagine being able to edit a person's genes to remove the faulty ones responsible for conditions like cystic fibrosis, sickle cell anemia, or muscular dystrophy. With CRISPR and similar technologies, this is becoming a reality. These advancements are not just theoretical. We're seeing real-world applications that have already started to change lives. One of the most exciting aspects of gene editing is its potential to prevent diseases before they even develop. By targeting the root causes of genetic disorders, scientists hope to stop diseases in their tracks, ensuring healthier lives for future generations. How AI and gene editing work together. The true magic happens when AI and gene editing come together. AI has the power to accelerate and enhance the process of gene editing by providing insights into which genes to target and how to do so with precision. For instance, AI can analyze vast amounts of genetic data to identify the genes that are responsible for particular diseases or conditions. This helps researchers narrow down which genes need to be modified and what the safest way to edit them would be. AI also plays a role in improving the accuracy of gene editing. One of the challenges with gene editing is ensuring that the changes made are precise and don't result in unintended mutations elsewhere in the genome. AI can help predict off-target effects, unintended edits that could cause harmful consequences. By using machine learning models, scientists can now better predict the effects of gene edits and minimize risks, making the process much safer. Another area where AI and gene editing are making a difference is in personalized treatment plans. AI can be used to analyze a patient's genetic profile and suggest the most effective gene editing approach. For example, in cancer treatment, AI can help determine which specific mutations are driving the cancer's growth and guide gene editing to correct those mutations. This approach goes beyond the traditional, one-size-fits-all cancer treatments, such as chemotherapy and radiation, and moves toward a more individualized strategy that targets the genetic basis of the disease. In the future, AI could also be used to monitor the effects of gene editing over time. After a gene editing procedure, it's crucial to track how the edited genes are behaving in the body. AI can process this data in real time, allowing doctors to adjust treatment plans if necessary. This dynamic, adaptive approach to personalized medicine will lead to more effective therapies and improved patient outcomes. Ethical considerations in gene editing and AI. While AI and gene editing hold tremendous potential, they also raise significant ethical and societal questions. One of the major concerns with gene editing is the possibility of unintended consequences. Editing the genome could have effects that we can't predict, and once a gene is edited, it's passed down to future generations. This could result in unforeseen genetic changes that affect not just individuals, but entire populations. There are also ethical debates surrounding designer babies, where parents could use gene editing to select desirable traits for their children, such as intelligence, physical appearance, or athletic ability. While this might sound like science fiction, the reality of gene editing technology brings us closer to the possibility of such practices, raising concerns about social inequality and the potential for misuse. Moreover, AI itself is not free from ethical issues. AI systems are only as good as the data they are trained on. If the data used to train AI is biased or incomplete, the predictions made by AI systems could be inaccurate or discriminatory. In healthcare, this could mean certain groups of people may not receive the same level of care or attention, exacerbating health disparities. Ensuring that AI algorithms are transparent, unbiased, and used ethically will be key to their success in medicine. The future of personalized medicine, a new era of healthcare. Looking forward, the combination of AI and gene editing could create a world where personalized medicine is the norm rather than the exception. Instead of treating diseases based on generalized assumptions, doctors could design treatments that are specifically tailored to each person's genetic makeup and unique characteristics. This could lead to treatments that are more effective, with fewer side effects, and lower costs due to the focus on prevention and early intervention. Additionally, the potential of gene editing and preventing genetic diseases altogether could change the way we think about healthcare. Imagine being able to prevent life-threatening diseases like cancer, heart disease, or diabetes before they even have a chance to develop. With AI's ability to predict genetic risks and guide gene editing, this future may be closer than we think. We could also see more widespread use of gene therapies that aim to cure, rather than just manage, chronic and inherited conditions. Diseases that have long been considered incurable, such as certain types of cancer, could eventually be treated at the genetic level, offering patients the possibility of a life free from the burdens of chronic illness. AI and gene editing are reshaping the landscape of medicine, opening up exciting new possibilities for personalized healthcare. While challenges remain, the combined power of these technologies promises to revolutionize how we approach disease prevention, treatment, and even cure. We are entering an era where medicine can be tailored to each individual, offering more effective treatments, fewer side effects, and better outcomes for patients. As we continue to explore this new frontier, it's important to remember that we must proceed with caution. Ethical considerations and safety must always be at the forefront as we unlock the potential of these groundbreaking technologies. However, if harnessed responsibly, AI and gene editing have the potential to change the future of medicine in ways we can only begin to imagine. Thanks for tuning in today. If you found this video insightful, don't forget to like, comment, and subscribe for more content on the latest in health and wellness. Until next time, take care and stay curious.